السلام عليكم ورحمة الله وبركاته. معكم دكتور صباح عبد الرسول حمودي، أخصائي جراحة الوجه والفكين، حاصل على شهادة البول في جراحة الوجه والفكين، وتدريسي في كلية طب الاسنان جامعة الانبار. محاضرتي موجهة لطلبة المرحلة الرابعة في مادة جراحة الفم. موضوع المحاضرة is the dental management of the allergic patients. Allergic reactions either during or after any dental procedure is one of the most serious problems and complications that a dentist may encounter. Drugs and other substances that may evoke allergic reactions are local anesthesia, antibiotics, and anxiolytic drugs, as well as various other dental materials or products. Drugs are the most common cause of the urticarial reactions in adults, while food and infections are the most common cause of these lesions in children. The allergic reaction is classified into 4 types according to their mechanisms. It is called gel and comb classifications of the hypersensitivity or allergy reactions. Class 2, in class 1, it's called immediate hypersensitivity reactions, which is mediated by the immunoglobulin E and with the release of the autocoils and degranulations of the mast cells. Class 2 hypersensitivity reaction, it is called cytotoxic reactions, which is mediated by the immunoglobulin G and involve antigen antibody complex, which is the trigger complement system, C1, C2, C3, and induce the lysis of cells. Class 3 hypersensitivity reaction, it is called immune complex reaction. It involves antigen antibody complex deposited in tissue. Class 4 delay hypersensitivity reaction, which involves the cellular immunity, not humoral immunity, but is involve the T lymphocyte and the release of the cytokines such as the interferon. Most common reaction occur in dentistry is the type 1 hypersensitivity reactions. Type 1 hypersensitivity reactions involve the immunoglobulin A antibody mediated, and the reaction occurs within seconds or minutes after contact with the allergen. The usual antigen is called allergen that induce type 1 hypersensitivity is the dust, mites, pollen, food, any type of the food, and drugs, which is called haptins. Type 1 hypersensitivity may be manifested in one of the following features. Type 1 hypersensitivity may be seen as an anaphylaxis, because anaphylaxis, which is an urgent urticarial rash that is occurring in the patient and may be fatal if not treated. Anaphylaxis is a term that may be involved in anaphylaxis, anaphylaxis, or anaphylactoid reaction, which is not result from the type 1 hypersensitivity, but cause signs and symptoms similar to anaphylaxis, so it is called anaphylactoid reactions. Other example of type 1 hypersensitivity is the hay fever. Patients with the hay fever is suffered from the congested nose and conjunctiva, stinging sensations of the palate due to the type 1 hypersensitivity. Asthma is an example of type 1 hypersensitivity that is results from the contact between the antigens, result in the initiations of the immunoglobulin E, which called bronchospasm. Urticarial and angioedema. Contact type 1 hypersensitivity cause urticarial, which is the itching sensations in the skin, with or without the swelling. Medical managements of the type 1 hypersensitivity. Patients with atopy may be given injections of antigens to gradually desensitize them so that they are no longer allergic to antigens. One method of treatment of the type 1 hypersensitivity is called allergen-specific immunotherapy, it is called desensitizations, such as patients with a hay fever, a dust mite allergy, or an animal allergy, sneeze a lot, and have a runny or stuffy nose. Many of these patients who have very severe and bothersome symptoms try out allergen-specific immunotherapy or desensitization. This treatment aims to make the immune system get used to the substances triggering allergy. In other words, it is no longer react as strongly to them, making the immune system less sensitive. The second line of treatment of the type 1 hypersensitivity is the steroids, such as the dexamethasone, betamethasone, others. Third line of treatment is the antihistamines. There are many generations of the antihistamines with variable degree of sedation, such as the loratadine, diphenhydramine, others. From a dental standpoint, the patient who is being treated for allergies has an increased chance of being allergic to another substances. Maybe the patient who have allergy to penicillin may have allergy to the local anesthesia, and so on. In addition, if this patient is taking steroids, his or her reaction to stress may be impaired. So during the dental treatment, the steroid dose may be double. Furthermore, if the patient should receive an organ transplant, such as the renal transplant, he or she may be susceptible to the infection and require prophylactic antibiotics before any dental treatments. Dental management of patients with any types of the type 1 hypersensitivity. One of the most common concerns to dentists is the patients who reports allergy to a local anesthesia, antibiotics, or analgesia. But the most important thing is to take the comprehensive history of the patients. Which type of the allergy antigens will cause the allergy? Which type of the antigen which may cause the allergy for this patient? Taking a comprehensive history is important to differential diagnosis between the allergy and pseudo-allergy that result from the not true allergic reaction. The adverse effect or the adverse reaction was of an allergic nature. One or more of the classic signs or symptoms of allergy should have been present. What are the signs and symptoms of allergy should be present? Urticaria, which is the itching sensation of the skin and mucous membrane. Swelling, skin rash, erythema, chest tightness, dyspnea and difficult and shortness of breathing, rhinorrhea, which is excessive leak of the fluid from the nostril, and inflammations of the conjunctiva, which is called the conjunctivitis. Any one or more of these signs and symptoms is suggestive of the allergic reaction. If these signs or symptoms were not reported, the patient probably didn't experience a true allergic reactions, but experience another examples of the pseudo-allergic reaction, such as the fainting or syncope which is occur after injections of the local anesthesia, is example of the mislabeled allergic reaction. Local anesthetics. Administrations of a local anesthetic to the patient. The adverse effects may be one or more of the following: toxicity reaction, central nervous system stimulation, or the local anesthesia may cause central nervous system depressions, vasoconstrictor effects, such as the tachycardia, swelling, and anxiety, or the local anesthesia may cause a true allergic reactions. How can you manage patients who have true allergic reactions? To the local anesthesia? If the history of the patient was consistent with true allergic reactions, the following point should be done. 1. Select anesthesia from a different chemical group. As we know, the local anesthesia may be either from the amine or ester groups. Amide groups, such as the lidocaine, procaine, while ester groups such as the procaine. So if the patient is sensitive or allergic to one anesthesia, such as the lidocaine, then we should choose anesthesia from the ester type. 2. After choosing the most likely safe local anesthesia, aspirate first and inject 1 drop of alternate anesthetic agents and wait for 5 minutes. If no reactions occurs, inject after the rest of the anesthetic agents needed is aspirated to be prepared to deal with an allergic reactions. In case of allergic reaction to several local anesthetic agents, or when a previously used anesthetic cannot be identified, there is an option of using diphenhydramine. Diphenhydramine, or using 1% solutions of diphenhydramine malate that contain 1 to 100,000 epinephrine, and this can be easily compounded by the pharmacist, but it must be confirmed that the solution not contain the methylparaffin, which is cause allergic reaction to the patient. This diphenhydramine can induce the anesthesia for average about 30 minutes duration and can be used for infiltration and block techniques. When it is used for the mandibular block, 1 to 4 ml of the diphenhydramine is needed to induce the anesthesia. If the history of the patient indicate it is not true allergic reactions, that should be dealt according to the cause, such as anxiety and anxious patients who feel or who are afraid from receiving the local anesthesias who may be suffered from the tachycardia, sweating, pain, and fainting syndrome. While toxicity, the most common cause of adverse effects of the local anesthesia isn't allergy, but it is the toxicity. The toxicity of the local anesthesia occurs due to the overdose or the inadvertent injection of local anesthesia in the blood vessels. The second most important drugs used in dentistry is the penicillin, allergy to the penicillin. The antibiotics that interest the dentist most, as far as the allergy is concerned, is the penicillin and its derivatives, because it is considered the antibiotic of choice in most cases of dental procedure. But the frequency of the allergic reactions due to the use of the penicillin ranges from 2 to 10%, and the reactions is manifest as a mild, severe, or even fatal. Patient allergic to the penicillin, so it's allergic to the beta-lactam rings, is also allergic to other penicillin derivatives such as the carpenicillin and methicillin. This patient has generalized urticarial rash after injection of the penicillin for treatment of the acute oral infection. Also, in patient to the allergic to the penicillin, there is a 5 to 10% to cross allergy with the cephalosporins, such as the Kipix. The procedures for prevention of a penicillin reaction. The dentist must have a kit, emergency kit in his clinic, that contain the emergency drugs, adrenaline, hydrocortisones, diphenhydramines, the oxygens, to deal with any emergency care. To take medical history on all patients, including the following: previous contact with penicillin, reactions to penicillins, allergic reactions to other agents. 3. Don't use penicillin in patients with a history of reactions to drugs. 4. Tell patients when you are going to give him penicillin. 5. Don't use penicillin in topical preparations, because it also causes allergic reactions. 6. Don't use penicillinase-resistant penicillin unless the infection is caused by the penicillinase-producing staphylococci, such as the augmentin, co-imixicillin. 7. Use oral penicillin whenever possible. It's preferred from the IM, IV, or topical penicillin. 8. Use disposable syringes for injections of the penicillin. 9. Have a patient wait in the office for 30 minutes after first dose of penicillin is given, and monitoring for this vital signs to ensure it isn't allergic to penicillin. Inform patients about the signs and symptoms of allergic reactions to penicillin, which include the skin rash, urticaria, rhinorrhea, conjunctivitis, chest, dyspnea or tightness, and if these occur, to seek immediate medical assistance. Oral complications and manifestations of the hypersensitivity reactions. that may encounter the dentist in his clinic. Type 1 hypersensitivity can produce oral lesions. These oral lesions can be produced by type 1 hypersensitivity reactions. May be caused by various foods, drugs, or anesthetic agents, and it occurs within or around the oral cavity and is usually characterized by arterial swelling, or it is called angioneurotic edema. Arterial swelling or angioneurotic edema. Angioneurotic edema is characterized by the following. This reaction occurs soon after contact with antigens. The reactions consist of painless swelling, such as seen in this patients who suffer from angioneurotic edema soon after injections of the local anesthesia, causing swelling of his upper lip that may be itchy. Management of the angioneurotic edema. The reaction not involving the airway passage, if not involving the tongue, pharynx, or larynx, and with no respiratory distress noted, but treated by using 50 mg of diphenhydramine 4 times daily until swelling is diminished. The true angioneurotic edema involves a tongue, pharynx, or larynx with respiratory distress. The following treatment should be done. 0.5 ml of 1 to 1000 epinephrine should be injected intramuscularly or subcutaneously in the tongue or in the pharynx. 2 administration of oxygen. 3. Once immediate danger is over, the patient should receive 50 mg of diphenhydramine given 4 times daily until the swelling diminishes. Type 3 hypersensitivity reactions. These usually occur within 24 hours after contact with antigens and consist of the red area, erythema, rash, or ulcerations, such as seen in this picture. This patient complained of stomatitis that occurred due to the allergy to the toothpaste which was used by the patient. This picture showing allergic rash on the abdomen of the patient who treated by orthodontic archwire and bracket. The patient was tested and was found to be allergic to the nickel in the wires. Type 4 hypersensitivity reactions. Contact stomatitis is a delay allergic reaction that is associated with the cellular immune response in T lymphocyte in most cases. It occurs after days after contact with the antigens, such as seen in this picture, the patient wearing removable partial denture, which cause allergic reactions, erythematous rash in the dentulous area. For the last oral complication and manifestations of hypersensitivity reaction is the diphenhydramine drug eruption. Some patients with skin and or oral lesions identical to those of lichen planus will be found to have taken certain drugs before the onset of their lesions. These drugs are withdrawn, the lesions clear within several days. In most patients, or within a few weeks, such as seen in this picture. Patient taking antihypertensive drugs that can influence the electronate reactions seen in the buccal mucosa. Management of the severe type 1 hypersensitivity reaction. If the patient faces conditions of anaphylaxis reaction, through anaphylaxis reaction, or angioneurotic edema, how can you deal with this patient? Even when the dentist has taken appropriate precautions, allergic reactions may occur. Most of these are mild, of an emergency nature, but some may be severe and life-threatening anaphylactic. The dentist must take the following actions immediately. Number 1, place the patient in the head down or supine position. 2, perform the APC, which involves make certain that the airway is patent. Administer of the oxygen. Be prepared to send for medical help and support respiration and circulation. Most reactions in dental patients consist of simple fainting, which can be well managed by these actions. In addition, the dentist may administer aromatic spirits of ammonia through inhalation, which encourage the breathing through a reflex stimulation. If these initial steps have been to solve the emergency problems, the problem is of an allergic cause, the dentist is faced with edematous type or anaphylactic reaction. What are the signs and symptoms of the anaphylactic reactions? Itching of the soft palate, nausea and vomiting, substernal pressure, shortness of the breath, hypotension, pruritus, urticaria, laryngeal edema, bronchospasm, and cardiac arrhythmia. Management of the anaphylactic reactions. Call for medical help. 2. Place the patient in a supine position. 3. Check for open airway and the breathing is still intact. 4. Administer of the oxygen. 5. Checking the pulse, vital signs, pulse, blood pressure, respirations. If these vital signs are depressed, we should use the epinephrine. If depressed or absent, the dentist should inject 0.3 to 0.5 milliliter of adrenaline with concentration 1 to 1,000 intramuscularly into the tongue, to provide CPR, cardiopulmonary resuscitations if needed, and repeat injections of the adrenaline if there is no response. Thank you for your listening.